Okay, so we're going to continue with the skeletal system and joints. This time we're going to talk about the movement at synovial joints, the structure of the knee, and arthritis. So remember, synovial joints all contain articular cartilages covering the ends of the bone, a joint cavity surrounded by a capsule of fibrous connective tissue, and a synovial membrane that secretes synovial fluid into the joint cavity. But synovial joints can contain additional structures, and they don't all look like this simple diagram. In fact, synovial joints are classified according to the shape of the bones in the joint, and that will determine the type of movement. Plane joints have two flat surfaces. It's a common joint. It allows a movement in two directions. Pivot joints have a circular projection inside of a ring, like in the neck, and they allow rotation. Hinge joints have a concave and a convex surface and allow movement again in one direction. Ball and socket joints have a rounded surface in a cup-shaped socket, very mobile joints. Ellipsoid joints, again, have a concave surface in a convex surface, but this time it's an oval or egg-shaped surface. And then saddle joints have two saddle-shaped surfaces. Okay, movement at joints has specific terms, and the type of movement depends upon the joint. But in general, we use terms like flex, extend, adduct, and abduct. To flex is to decrease the angle between the bones involved in the joint. So to flex the shoulder, you are decreasing the angle between the upper arm and the chest. To extend that joint, you increase the angle. To adduct the arm means to move it towards the midline, towards anatomical position. To abduct it is to move it away from the midline, so to raise it up. To rotate is to spin on an axis. So it would be like moving your hand in and out rotates your upper arm. And then to circumduct means to move in a circle. There are other types of movements possible, but you should know at least these 6. All right, and as far as knowing all the joints, that's something you might have to do if you worked in an orthopedic field. But for us, the really only synovial joint I want you to know in any detail is the knee joint. The knee joint is a complex joint, and it's one that we often hear about with athletics, whether it's basketball, baseball, volleyball, or football, because it's so often injured. It's a joint that has, well, where the femur rests on the tibia, but it's not a single projection of the femur resting on the tibia. It's actually 2 projections. The medial and lateral condyles of the femur rest on the medial and lateral condyles of the tibia. Okay, and so this is 2 ellipsoid joints. And then it's not only has articular cartilages and a joint capsule and a synovial membrane, there are many additional ligaments. There are menisci, cartilage pads to try and keep the bones aligned. The ligaments include some internal ligaments, the anterior cruciate and the posterior cruciate ligament, and then some external ligaments, the collateral ligaments, the tibial and fibular collateral ligaments. The knee has to have all this extra support because it carries so much weight, and it's used in running. Okay, one of the things about the knee is it flexes and extends well, but it allows for very little rotation. And that means whenever the knee gets a blow that's to the lateral or medial side, that it's going to be trouble for the ligaments on the other side and in the center of the knee. Often you hear about damage to the anterior cruciate ligament because that ligament, if you get a blow from the lateral side of the knee, that ligament is going to take the greatest amount of force. That used to end many athletes' careers, but now it can be surgically repaired. Okay, another injury or condition of the joints that you often hear about is arthritis. Arthritis is a general term for inflammation of the joints. The joints become swollen and painful, and then they will have restricted movement. Arthritis affects many, many Americans. About 55 million Americans have symptoms of arthritis. That's like one in 7. And the amount of cost, it's a huge amount of cost, $300 billion. We generally classify arthritis as osteoarthritis or rheumatoid arthritis. Osteoarthritis is kind of an overuse injury type disorder, whereas rheumatoid arthritis is a series of disorders where it's either infection or autoimmunity triggers that. In arthritis, we've got these two types, and obviously then that means that there's different causes here. Most commonly for older people, it's age and overuse of the joint starts to wear away the cartilage. That causes inflammation. Bone gets deposited where cartilage should be. The joint becomes painful and swollen. This is even more likely if that joint has been injured in sports or some other ways earlier in life. But we know of many infections that can cause arthritis. Lyme disease is probably one of the most common ones, but there's others as well that cause inflammation of the joints and damage in the cartilage. And for others, we just know it's an autoimmunity. In some cases, it's unknown. We identify risk factors, age being one of them, uh, being heavy, having these previous injuries to the joint, and for the rheumatoid arthritis, it's being female. Being female is puts you at higher risk for autoimmunity. Women have stronger immune systems than men. Well, arthritis, we can treat arthritis. The most common treatments are drugs to reduce inflammation. This might be aspirin, NSAIDs. These are non-steroidal anti-inflammatory drugs like ibuprofen, and then corticosteroids. These are the most common treatments for arthritis, is trying to reduce that inflammation. We also, for arthritis, it's often painkillers and sometimes anti-rheumatic drugs, drugs that kind of turn down the immune system specifically in people that have rheumatoid arthritis. If arthritis isn't too serious, physical therapy and range of motion exercises can help. Sometimes we can have surgery to repair the surfaces in the joint, to trim damaged cartilage, to remove pieces that might be floating around. Other times, the joint itself has to be replaced. And so with large joints like the hip or the knee, we're capable of replacing that with metal and uh, synthetic materials.